You wake up tired, your belt has moved out one more notch, and your blood tests show high blood pressure, sugar, and cholesterol. Yet, from the outside, nothing seems urgently wrong. This quiet collection of risks has a name: metabolic syndrome. It is like a slow, invisible fire smoldering inside your arteries. Today, we will enter that hidden world and explore how, according to Dr. Esselstyn's work, food itself can become your most powerful medicine or your most dangerous fuel. Dr. Caldwell Esselstyn spent years at the Cleveland Clinic treating patients whose chests he had to open to save their hearts. He saw the same arteries clog, the same operations repeat, like trying to mop up water while the tap stayed open. Eventually, he asked a radical question. Instead of repairing the damage again and again, what if we turned off the cause? His answer was not a new drug or device, but something found in every kitchen: food. Metabolic syndrome is not a single disease. It is a cluster of conditions: abdominal obesity, high blood pressure, high blood sugar, unhealthy cholesterol, and triglycerides that travel together like a gang. Each one alone raises risk, but together they greatly accelerate damage to arteries, liver, and pancreas. Imagine 5 rusted links in a chain that carries blood to your heart and brain. The chain may not snap today, but every day it grows weaker. For many people, metabolic syndrome feels abstract, just numbers on a lab printout. But to the inner lining of your arteries, the endothelium, those numbers are a daily storm. High sugar scratches it, high fats and cholesterol clog it, high pressure pounds it. Over years, this gentle protective surface becomes inflamed, cracked, and coated with plaque. This is how metabolic syndrome quietly marches toward heart attack, stroke, and type 2 diabetes. Dr. Esselstyn made a bold promise to some of the sickest cardiac patients. If they followed a very low-fat, whole food, plant-based diet with discipline, their heart disease would not only stop progressing, it could actually begin to reverse. At first, colleagues doubted him, and patients were skeptical. Could changing what was on their plate possibly reopen blocked arteries that once required surgery? That question is what keeps viewers like you watching until the final scene. Think of the hospital emergency room as a fire station constantly rushing to put out blazes in people's arteries. Stents, bypasses, and drugs are like powerful fire hoses. Yet, if we ignore the sparks, the foods and habits that ignite inflammation, we condemn ourselves to repeat emergencies. Esselstyn moved the battlefield from operating room to dining room, asking, what if, instead of waiting for the fire, we redesigned the entire neighborhood so it simply could not burn so easily? Running through every artery is a delicate one-cell-thick layer called the endothelium. It releases a gas, nitric oxide, that relaxes vessels, keeps blood flowing smoothly, and prevents sticky cholesterol from clinging. Esselstyn treats the endothelium like a sacred garden. Metabolic syndrome is like acid rain falling on this garden day after day. The soil erodes, the plants weaken, and weeds of plaque take over. Protecting this lining becomes the core mission. Every meal is like a conversation with your arteries. Animal fats, refined oils, sugary drinks, and processed snacks speak in a harsh tone, stiffening vessels and dimming nitric oxide. Whole grains, beans, vegetables, fruits, and leafy greens speak gently, soothing inflammation, improving insulin sensitivity, and nourishing the endothelium. Over months and years, these daily conversations write the story of your heart, one plate at a time. Metabolic syndrome does not shout, it whispers. A bit more belly fat, slightly higher fasting glucose, creeping blood pressure, but beneath the numbers, fat cells leak inflammatory chemicals. The liver struggles with excess fat, and muscles become deaf to insulin's message. The body compensates until one day it cannot, and a heart attack or stroke seems to appear out of nowhere. In truth, it had been building silently for years. Imagine a 50-something patient who had already survived a heart attack. He took his pills, but his metabolic syndrome remained. High triglycerides, elevated blood sugar, central obesity. Angiograms showed severe blockages. Surgeons were ready to operate again. Instead, he entered Esselstyn's study, choosing to change his life instead of simply repeating procedures. This was not a miracle story yet. It began with fear, doubt, and a refrigerator full of familiar foods. This patient stood at a symbolic fork. One path was familiar: continue current habits, rely on medications and possible new surgeries. The other was unfamiliar and demanding: a strict whole food, plant-based diet with almost no added oils, low in fat, and rich in fiber. Esselstyn was clear. This was not a casual suggestion, but a therapeutic prescription. Many people with metabolic syndrome will face a similar choice. Which discomfort do you choose? The discomfort of disease or the discomfort of change? Esselstyn's program, based on his clinical work, is simple but strict. No meat, poultry, fish, or eggs. No dairy. Avoid added oils, including olive and coconut oil. Stay away from processed foods rich in sugar, white flour, or refined grains. Instead, build meals from whole grains, beans, lentils, vegetables, fruits, and especially dark leafy greens. For those with heart disease or metabolic syndrome, he frames this not as restriction, but as intensive care delivered through the fork. In Esselstyn's approach, leafy greens are not just side dishes, they are daily medicine. Spinach, kale, Swiss chard, arugula, and others are rich in nitrates and antioxidants that help the endothelium produce more nitric oxide. He often recommends eating them several times a day, especially with vinegar or lemon, to support vessel health. For a person with metabolic syndrome, these greens act like gentle hands, continually polishing and protecting the artery walls. In metabolic syndrome, the liver becomes a crowded port, flooded with incoming fat and sugar. Excess saturated fat and refined carbohydrates can lead to fatty liver, worsening insulin resistance, and abnormal cholesterol. A low-fat, whole food, plant-based diet lightens this load. Less saturated fat, more fiber, and complex carbs allow the liver to slowly unload its cargo, improving lab numbers over time. This is not overnight magic, but steady biological housekeeping. People with metabolic syndrome are often told, carbs are the enemy. Esselstyn draws a crucial distinction. Refined carbohydrates, white bread, pastries, sugary drinks do spike blood sugar and worsen insulin resistance. But complex carbohydrates and intact grains, beans, and vegetables come packaged with fiber and micronutrients. They digest slowly, feeding gut bacteria, stabilizing glucose, and supporting satiety. The problem is not the carbohydrate itself, but the factory that stripped it bare. Most modern diets are starving for fiber. Esselstyn's plan flips this, flooding the body with natural fiber from plants. Fiber slows sugar absorption, feeds beneficial gut microbes that may reduce inflammation, binds some cholesterol in the gut, and supports weight loss by increasing fullness. For metabolic syndrome, it is like adding traffic lights and roundabouts to a reckless highway of sugar and fat, bringing order to metabolic chaos. High blood pressure is like constantly leaning your full weight against a fragile glass window. Over time, tiny cracks form in the endothelium, inviting plaque. Plant-based diets rich in potassium, magnesium, and nitrates, and low in sodium and saturated fat can help many people reduce blood pressure. Some in Esselstyn's experience saw their numbers fall enough to reduce medications, always under physician guidance. Never adjust medication on your own. Always consult your doctor. In insulin resistance, common in metabolic syndrome, cells act as if their doors are jammed. Insulin knocks, but sugar remains in the bloodstream. Evidence suggests that excess fat inside muscle and liver cells interferes with insulin's signaling. Low-fat, plant-based diets with weight loss can reduce this fat, helping doors open again. Over months, fasting glucose and A1C can improve. Yet, each person responds differently, so medical supervision and regular testing are essential. Cholesterol travels in lipoprotein cars through your bloodstream. LDL tends to deliver cholesterol into artery walls. HDL helps carry it away. Diets high in animal fats and trans fats increase LDL traffic and small, dense particles that slip easily into damaged endothelium. Esselstyn's patients on a low-fat plant diet often saw LDL numbers fall dramatically. For someone with metabolic syndrome, each drop in LDL is like removing a few trucks from a dangerously overcrowded bridge. When Esselstyn repeated angiograms in compliant patients, including some with metabolic syndrome, he saw something once thought impossible. In several cases, blockages had not just stabilized, they had partially regressed. Arteries looked more open. Symptoms like chest pain diminished or disappeared. These were not isolated miracles, but consistent results among those who embraced the diet fully. Food seemed to be doing what surgery and stents alone could not, changing the terrain itself. Many viewers fear that a plant-based, low-fat diet means constant hunger. In Esselstyn's program, patients ate until comfortably full, just from very different foods. Plants are less calorie-dense, but more nutrient-dense. Stomach stretch receptors still signal satisfaction, while total calories often drop naturally. For people with metabolic syndrome, this can mean losing significant weight without strict portion counting, as long as oils and processed foods stay off the plate. At first, Esselstyn's patients struggled with cravings for cheese, meat, and sweets. The pleasure centers in the brain, long trained by salt, sugar, and fat, protested loudly. But within weeks, many reported that their tastes changed. Fruit tasted sweeter, greens less bitter. This is neuroplasticity, your taste buds and brain circuits adapting. For metabolic syndrome patients, the early weeks are like taming a restless horse. With time and steady hands, the ride becomes smoother. Restaurants, family gatherings, and business trips can feel like obstacle courses. Esselstyn's patients learn strategies, calling ahead to request plain rice and vegetables, bringing their own sauces, or eating a small, compliant meal before events. They practiced explaining their choices calmly, framing the diet as medical treatment. For someone with metabolic syndrome, protecting your arteries in these moments can mean the difference between slow healing and silent sabotage. Some of Esselstyn's patients found that the hardest part was not the food, but the reactions of loved ones. Partners felt threatened, traditions were challenged, and some even tempted patients with old favorites. Change can mirror people's fears about their own health. Esselstyn encouraged involving family in education sessions and sharing lab results. Over time, as weight, energy, and mood improved, many skeptics quietly became allies and sometimes participants. Metabolic syndrome often travels with emotional burdens, anxiety about lab results, fear of heart attacks, even depression. Many people use food for comfort. Esselstyn's program does not dismiss these feelings. It acknowledges them. Some patients reported mood improvements as inflammation decreased, and they felt more in control. Yet mental health is complex. If you feel persistent sadness, anxiety, or hopelessness, please seek support from a mental health professional in addition to changing your diet. Esselstyn emphasized regular follow-up, weight, waist, blood pressure, fasting glucose, A1C, lipids. Each number became a chapter in a new story. For metabolic syndrome, improvements often appear first in triglycerides and blood pressure, then in waist circumference and insulin resistance. Documenting these changes can turn discouraging discipline into visible victory. Always partner with your physician to interpret these results and adjust medications safely as your body heals. One of Esselstyn's favorite moments was when patients realized they had walked upstairs without chest pain, or their angina simply stopped. For those with metabolic syndrome, it might be sleeping through the night without snoring, walking farther without breathlessness, or seeing swollen ankles shrink. These small victories feel like the body whispering, "Thank you." The same arteries once rushing toward disaster now begin, slowly, to repair. Not every story is straight upward progress. Some of Esselstyn's patients slipped, holiday feasts, business travel, stress, cholesterol, and weight crept back up. Chest discomfort sometimes returned. Instead of condemnation, he offered data, angiograms, and labs clearly showing the consequences. This honesty helped them recommit. If you live with metabolic syndrome, relapse is not failure. It is information. What matters most is your next choice, not your last one. Beyond cholesterol and sugar, metabolic syndrome fuels chronic, low-grade inflammation. Markers like C-reactive protein often rise, signaling an immune system on constant alert. Plant-based diets rich in antioxidants, fiber, and phytochemicals may help lower these inflammatory sparks. Esselstyn's focus on unprocessed plants aligns with growing research linking such diets to lower inflammatory markers. Less inflammation means a quieter, safer environment for your arteries and organs. Esselstyn wrote before gut microbiome research exploded, yet his plant-rich approach fits perfectly with new findings. Fiber and plant diversity feed beneficial bacteria that produce compounds like short-chain fatty acids, which may improve insulin sensitivity and reduce inflammation. By contrast, animal-heavy, low-fiber diets can foster microbes that make potentially harmful molecules such as TMAO. For metabolic syndrome, your gut flora become quiet co-authors of your metabolic health. Many worry, where will I get protein? Esselstyn's patients obtained ample protein from beans, lentils, tofu, whole grains, and vegetables, without the saturated fat and cholesterol that often travel with animal protein. For metabolic syndrome, this matters. Protein is essential, but so is its package. Think of plant proteins as receiving a gift wrapped in green leaves and fiber instead of in layers of fat and LDL. Esselstyn advocates a very low total fat intake, especially for those with advanced disease. He remains cautious even with plant oils because of their calorie density and potential impact on the endothelium. However, whole food sources, like small amounts of nuts, seeds, and avocado, may be handled differently by the body, especially in less severe cases. For metabolic syndrome, any changes in fat intake should consider individual conditions, medications, and be discussed with your physician. One core idea from Esselstyn's work is to eat foods as close as possible to their natural form. An orange is more than vitamin C, a bean is more than protein. The synergy of fiber, micronutrients, and plant compounds may explain why whole foods outperform supplements in many studies. For metabolic syndrome, this means focusing less on isolated nutrients and more on patterns. Whole grains over flour, whole fruit over juice, intact plants over pills. Some fear that embracing Esselstyn's diet means abandoning medications. In reality, he worked alongside cardiologists and primary care physicians. Medications like statins, blood pressure drugs, and diabetes medicines often remained, especially at the beginning. As patients improved, doctors sometimes reduced doses. Diet is not a replacement for essential drugs, especially in high-risk metabolic syndrome, but a powerful partner. Always coordinate changes with your healthcare team. Esselstyn's main focus was diet, but no body thrives on food alone. Poor sleep and chronic stress worsen metabolic syndrome by increasing cortisol, raising blood pressure, and driving cravings. A plant-based diet can support calmer biology, but pairing it with regular sleep, relaxation techniques, and gentle exercise magnifies benefits. Think of your health as a tent. Diet is a central pole, yet it still needs other poles, sleep, stress management, movement, to stand steady. Moderate, regular exercise improves insulin sensitivity, raises beneficial HDL, lowers blood pressure, and boosts mood. Esselstyn encouraged movement appropriate to each patient's capacity, working with their doctors. For someone with metabolic syndrome, even brisk walking can act like a gentle pump, encouraging better circulation and helping the endothelium. If you have heart disease, chest pain, or limited mobility, discuss any exercise plan with your physician before starting. One patient arrived with severe metabolic syndrome, high blood pressure, triglycerides over 400, fasting glucose in pre-diabetic range, and a large waist. Within a year on Esselstyn's program, guided by physicians, he lost over 20 kilograms, triglycerides dropped by more than half, blood pressure normalized, and his fasting glucose returned to near normal values. Most striking was his new energy. He described it as waking up in a body that finally felt like mine again. A woman in her early 60s with metabolic syndrome and angina feared she would not see her grandchildren grow up. Adjusting to Esselstyn's strict diet was challenging at first. She cried letting go of beloved recipes, but she transformed them. Chili with beans instead of meat, oil-free stews, fruit-sweetened desserts. Over time, her angina vanished, waistline shrank, and lab markers improved. She began saying, "I am not just surviving heart disease, I am outliving it." Not everyone's numbers changed rapidly. Some patients with long-standing metabolic syndrome saw only modest improvements at first. Esselstyn counseled patients. Years of injury do not heal in weeks. Even when weight or labs change slowly, many reported less heartburn, better bowel movements, and steadier energy. These are signs of internal shifts. If your progress feels slow, remember, you are still feeding your endothelium, calming your liver, and supporting your future self. Esselstyn often educated patients in small groups, where they shared recipes, setbacks, and victories. For metabolic syndrome, such community can be life-changing. Hearing others with similar struggles normalizes your fears and fuels your motivation. Support groups, online forums, or plant-based meetups can provide practical tips and emotional strength. Healing is easier when you're not the only one at the table eating differently. Food is not just fuel, it is memory, culture, and identity. Esselstyn's patients came from diverse backgrounds, each with cherished dishes. Rather than abandoning culture, they learned to adapt recipes, removing animal fats, dairy, and oils, while preserving flavors with herbs, spices, and whole grains. For metabolic syndrome, this is vital. Your new way of eating must still feel like home. Health cannot grow in soil where your heart feels exiled. Esselstyn encouraged patients to become detectives in the supermarket. For metabolic syndrome, reading labels becomes a daily shield. Check for added oils, sugar, and refined flours. Look at fiber content. Higher is usually better. Aim for ingredients you recognize, not long, chemical-sounding lists. Each package is either a quiet ally for your arteries or a disguised saboteur. The more fluent you become in label language, the safer your cart becomes. A typical Esselstyn-style day for someone with metabolic syndrome might start with oats, fruit, and flax seeds, lunch of bean and vegetable soup with whole grain bread, snacks of fruit or carrots and hummus, dinner of brown rice or potatoes with a mountain of vegetables and greens. The principle is simple. No animal products, no oils, minimal processed foods. Within this frame, there is enormous culinary freedom. Simplicity is not the enemy of pleasure. Some patients with metabolic syndrome struggle with intense evening hunger and late-night snacking. On a plant-based, low-fat diet, large volumes of food are allowed. You can front-load calories earlier in the day, eat hearty dinners with beans and grains, and keep cut fruit or vegetable soups available. Esselstyn reminded patients to ask, is this physical hunger or emotional habit? Whichever it is, respond with compassion, not shame, and choose foods that still honor your arteries. Sometimes lab results plateau or even worsen temporarily despite adherence. Esselstyn asked patients to review the big picture: overall trajectory, consistency of diet, weight trends, sleep, stress, and medications. For metabolic syndrome, temporary fluctuations may reflect infections, stress, or lab variability. Rather than giving up, these moments are invitations to refine habits, more greens, less salt, better sleep, and to discuss results in detail with your healthcare provider. Some people say heart disease runs in my family, or everyone on my father's side has diabetes. Esselstyn's message is not that genes are irrelevant, but that for many, they load the gun while lifestyle pulls the trigger. Metabolic syndrome may reveal your genetic vulnerabilities early. A rigorous plant-based diet cannot rewrite your DNA, yet it can profoundly influence how genes are expressed. You cannot choose your cards, but you can choose how you play them. Although Esselstyn's clinical work focused on adults, his message reaches forward. Today, more children show signs of early metabolic problems, obesity, elevated blood pressure, fatty liver. When adults in a household shift to plant-based meals, children observe and often imitate. You're not just healing your arteries, you may be rewriting your family's culinary history. Always work with pediatricians for children's specific needs, but know that every healthy meal plants a seed for their future hearts. Esselstyn's claims are bold, but they are not fantasies. He published peer-reviewed data showing arrest and partial reversal of heart disease in patients who adhere to his program. Other studies of plant-based diets support improvements in blood pressure, cholesterol, weight, and diabetes control. Science continues to evolve, yet the central message is consistently reinforced. Whole food, plant-based patterns can be a powerful tool for people with metabolic syndrome alongside medical care. If you decide, with your physician's guidance, to try an Esselstyn-style approach for metabolic syndrome, focus on the first 30 days. Clean your kitchen of trigger foods. Learn 3 simple breakfasts, 3 lunches, and 3 dinners you enjoy. Plan grocery lists, prepare batches of beans and grains, schedule follow-up labs. Treat this month like a personal clinical trial. Observe your body, your energy, your mood. Let data and feelings, not fear, guide your next steps. Metabolic syndrome may feel like a slow sentence written in lab results and tight waistbands, but it is not the end of your story. Esselstyn's work shows that, with committed changes in what you eat and how you live, guided by your own physician, your arteries can quiet, your risks can fall, and your life can widen again. If this video has given you hope or clarity, please subscribe, like, and share it. Then, take one concrete step today toward the heart you want to live with tomorrow.